I want to welcome everybody to the December 10th Region 7 Disaster Health Response Ecosystem Preparedness Webinar, How Strike Teams Have Changed Missouri's Disaster Behavioral Health Landscape. My name is Thomas Barnett. I'm one of the project managers with the Region 7 Disaster Health Response Ecosystem. The purpose of these webinars is to provide a variety of preparedness and response topics to our healthcare, public health, and emergency management community and beyond. As such, we thank our many collaborating organizations and presenters for making these webinars possible. These webinars are not intended to be redundant or to replace any organization's initiatives, but are meant to support all levels of emergency preparedness and response. These webinars enable emergency preparedness and response individuals and organizations to share their successes, challenges, and lessons learned with others in the preparedness community in an effort to create a more resilient and better prepared ecosystem in HHS Region 7 and beyond. Today we have with us Tamara Fish. Tamara is the Disaster Crisis Services Liaison for the Department of Mental Health in the state of Missouri. She graduated from Brandman University with a Bachelor of Science in Psychology, and she later graduated from the University of Phoenix with a Master of Science in Public Administration. Tamara served in the United States Navy for 10 years until she received an honorable discharge, and she currently works on Missouri's 988 campaign with the Department of Mental Health's Office of Disaster Services. Her focus is the behavioral health strike team and ensuring disaster behavioral health is made a priority within the state. The R7DHRE thanks Tamara for her willingness to share her experience and knowledge with everyone today. And with that, I will turn it over to her for today's presentation.
Hello, everybody. So let me share that screen again. And hopefully you can all see that. So just to kind of go through this. So like I said, I was in the military for 10 years. I got an honorable discharge, but the fun aftermath of military service, I actually had a traumatic brain injury while I was active. So I get to have fun moments where I sometimes forget the word that I want to say. So it doesn't hurt my feelings if you pop it in the chat if you think you know what I'm trying to say, because it's frustrating when you know the word is there and it won't come out. Just those super fun gifts the military left me with after the fact. But so I'm going to jump right in. So this is me, and then Becky Gear is actually my supervisor. She's the director for the Office of Disaster Services. She's not actually on today, so she gets to sneak out of this. But I'm going to jump right in. So how we've changed the disaster behavioral health landscape. What are we even? So we're going to jump into that, who we are, what we are, why we are, and all of those good pieces. So let's do this. Now, we came to be because of the Joplin tornado in 2011. There were so many pieces in that aftermath where we had first responders everywhere. We had, I mean, you all saw the news. You saw how devastating it was and how we lost so many lives just so tragically. Um, and we found that we needed something more. The state of Missouri needed to have something to do with behavioral health on the ground in the immediate aftermath. And those of us in like the disaster behavioral health landscape know that that can help mitigate that long-term trauma. Uh, and it's an incredible opportunity for communities to get involved and very quickly like provide that psychological first aid on the ground. So after the tornado in Joplin hit, there were moments where we found that there were casualties that had been misidentified and had gone, we couldn't find anybody. We didn't know what hospital or even what state they were in. And then we had situations where there was a 3-year-old young man who he couldn't be found. And then they thought they found him. It was misidentified. The family was notified. It was not the right child to the family. And so, as you can imagine, that was incredibly devastating for everybody involved. SEMA, the State Emergency Management Agency, came to realize that we need to have more on the ground. We need to be more involved. We need to find a way to get that behavioral health piece in there to help mitigate that trauma. So we started talking, and this is kind of how it came about. Um, we discovered that we needed to have like this those boots on the ground in the moment as quickly as possible. What can we do to get first responders, mental health first responders to the sites? And then what does that look like? How's it going to happen? What do we do if there's a large scale event and how do we operate? So 2017 is when we kind of got the funding and got started. And as you can imagine, funding is a bear. It's a pickle of its own. So we finally got things put together and going in 2017. Now, we it was a very small operation. The Office of Disaster Services at that point had two people. So how do you get boots on the ground with two people, especially in Missouri, where there's just we have all of the things in Missouri. Any crap weather, it feels like it finds its way here. And it's all at the same time. Every county is affected. You've got a flood on half the state and then a drought on the other half. So how do we get in there and how do we help? So it took a lot to get buy-in, to get community mental health operations involved. But once that happened, once we really started going, it was like the sheer volume of help that we were able to provide was, I would say, legendary for Missouri. It was great. So ultimately, our goal is to provide immediate psychological first aid in the aftermath of the event. Um, we provide it to first responders, to survivors, to other, sometimes to us on the ground, because ultimately it is our communities and we are affected as well. So that psychological first aid, if you guys haven't taken it, I'd highly recommend it. At the end of this, there's links to everything. So if you haven't taken it, I would recommend it. Um, so what does it require to be a part of the strike team? So these are the requirements we set in place. If you guys haven't worked with Nova before, I would recommend it. It is not cheap, and we were not able to do that out of the gate, but we are now. Grant funding being what it is, we were able to provide those classes. So they provide like that crisis response team intervention training where you can kind of do like a group session, but it's not therapy. It is absolutely not therapy. It's just in the aftermath. And that really focuses on mass casualty events. And we ask all of our strike team members to be a part of that, to take that training, because you never know when you're going to need it. Obviously, PFA. We do have like the ICS systems, 100, 700, those are required. We do, we're required 2 annual trainings a year. And as of last year, we started doing conferences. We got funding so we can provide a disaster behavioral health conference in the state of Missouri. And I would recommend if you want to come to that, it's awesome. It only costs $50 to attend. The rest would be on you, but it's incredible. We have national speakers who come in. We have people from Vibrant who come in and provide. The National Mass Violence Center has come in and done a huge amount of training for us. We record these trainings. We keep a catalog of them and we can send them out to our strike team members as they need more trainings. So really valuable stuff. We do a lot of like full scale events too, like full scale exercises. We partner very closely with SEMA. And this last year we did, uh, it was a New Madrid uh, event. It was our full scale victim information center exercise. And so we had like FEMA came in and kind of helped us navigate that and make it functional for everybody. And it was incredible. The year before that, we worked with St. Louis International Airport and we did the idea was what happens if a plane crashes at the airport? How do we function that? What's the VIC look like? So we do have some of the photos of that up in here. It was really, they did it they didn't go small on that. That was a huge deal. Um, so let's talk about the impact. Things that we have done. I'm probably going to stay on this one for a minute. And I don't know, I can't see the chat. So if there are any questions or anything in the chat, if someone will let me know, that would be great. Um,
there is one question in
oh
there. We
yeah,
want to take a second real quick here
yeah,
because
please. I'd love to.
it's asking for a link for the psychological first aid course, and I
Oh,
know that there's a number of different courses out there for it, and so I was going to get your take of which one you were using or which one you recommend or anything like that.
I was NCTSN. So, and I do believe I have the link at the end of this.
Okay,
But I'm happy to once I'm done here, but I pop that in the chat. But if you go into Google and you type in the National Center or NCTSN Traumatic Stress Network, that is their course. Um, and it's free. It's a 6 hour course if you do it in person. And then well, it's kind of at your own pace online, but it is free. It's a free course.
perfect. I can track that down while we're going. So
No, that is perfect. And if anybody like we have that recorded out as well. Dr. Patricia Watson was one of the creators of the psychological first aid. And she was gracious. That's the one right there. I just saw it pop up. Yeah. So she was gracious enough to record the training for us. And I don't think it would be an issue to share that out. So, and we do frequently do train the trainer courses where Dr. Watson has actually come in and done a train the trainer course for us. And we're happy to accommodate others that want to do that so they can teach it. So you just shoot me an email, my contacts at the end, and we'd be happy to walk you through that. And it is incredibly, I can't begin to tell you how valuable that is. I just taught the course at a hospital, um, and they didn't realize how valuable that would be until they had like a minor event in their city, and they were like, "Oh, we use this like every day. Like, who knew this was the perfect way to get in and just open up to get people to talk?" We used psychological first aid very heavily after the Kansas City Super Bowl parade. We had a lot of folks affected. Um, it was terrifying, and it kind of ended up being a different situation altogether because it wasn't actually a violent mass casualty event. It was an incident where somebody was angry and had a gun, and it was a targeted event, but so many were affected from that. Um, but that was an incredible opportunity for us. Some of the things that we do. So I don't know if you guys will talk about like the Branson duck boat incident in 2018 was our first real deployment. Um, what that looked like for us by 2018, we had started reaching out to the community mental health centers, and we had started these partnerships with other agencies. So when we would say, "Hey, we're going to deploy, can you go?" We would gather a great group of people who are all trained. And then we headed to the duck boat incident. And I don't know if you guys know what happened with that, but it was very tragic. It was a stormy day. There were people on the duck boat. If you know what that is, it's a vehicle that goes from the land into the water, and it was a very stormy day, and they should not have gone into the water. It was a family reunion. It was 17 members of one family were on that boat, and it capsized, and they lost the majority of the people on that boat. Um, we were there within hours. We were able to set up reunification spots so family members looking for other families could be there. Um, we were able to get one of the biggest challenges was the media. So we were able to redirect and get people away from the media because they were coming up to families and really trying to get in there and talk to them. And that was very brutal. With the media also being on site, we had our dive teams down there doing recovery, and they could only do the recoveries at night because the media was so bad. And we were able to provide long-term care for the recovery crews as well because those dive teams, that was very hard for them. Very, very hard for them. And I will be honest, we still check in with them to this day because that was our first event and we all bonded very, very heavily. So, now, as we all know, we had a great team. We rolled into 2020 and we had, I want to say 220-ish people on our behavioral health strike team. And what happened in 2020? COVID. And so by the end of COVID, and I want to say roughly 2023 rolled around, we had about 60 members that were partially active. So that's when I came in and we started doing recruitment again. In 2022, we had the school shooting in St. Louis, and that was our longest response. Typically, we want to be there and get everybody referred to community mental health as quickly as possible. This school shooting was very traumatic and it affected not just that community, but I think we had 17 schools roughly that requested our help after that. And so that took a lot of coordinating, and it was about a year and a half response, like just getting people there, getting people met with the right resources because the level of like the affected level was different depending the further out you go in that like kind of population area. So um with so those were kind of our bit. We had the Amtrak train derailment too, which was very challenging. But one of the pieces that our strike team is able to do is we have MOUs with different not like doctors' offices and pharmacies. So if somebody needed critical medication, because that's not something people think about in the immediate aftermath, after a tornado, in this train derailment, we had folks who needed like life-saving medication that they couldn't access. Uh, so they were able to work with a pharmacy that was close by, get them that immediate medication, and get a referral out to their primary doctor in whichever state it was that they were from. Now, with the Amtrak train derailment and the Branson duck boat incident, we had very similar issues because it was transitory. Not a lot of those people were from the state of Missouri, so it was hard to navigate getting them follow-on care. Um, and I don't know if anybody's ever worked with NTSB, but they're not always the most accommodating because it is their disaster at that point. It is their investigation. And so people kind of disappear in the wind. So that's a pickle. Um, those relationships since then have become far more developed and it's really, really nice. Um, we have recently, in the last year and a half, have started doing partnering with our disaster medical assistance team here in Missouri. So our big like hoorah, like get in there, gate opening moment was Mardi Gras in St. Louis. And I did not know this until then, but apparently the St. Louis Mardi Gras is the second largest celebration of Mardi Gras in the US. Had no idea. Learned the hard way. Um, and that was our first time working with DMAT, and they had no idea how it was that partnership would work. So I think my favorite thing about that they got to see and experience exactly how we can assist them. Uh, People, when they're drunk, get emotional. First responders really need to focus on the sick, critically injured in that, and sometimes it's harder for them to do the mental health stuff. So it was great that we were there. We were able to separate whoever was having this emotional, um, my friend is injured, my phone died, I need XYZ, and they were able to focus on those medical pieces. After that, they were like, "Can you guys please come to everything we do?" So we said yes, and then we participated with them at our Missouri State Fair, and the incredible relationships that came from that really made a huge difference. It was perfect. We did some really great work with kids who had broken their arms, and so the nurses and doctors were busy treating them, and we sat there and helped distract them so they weren't scared. But we also helped family members who were very nervous about what was happening. So we were able to kind of use those psych first aid pieces and just kind of de-escalate and calm everyone. And it made the experience of having to do anything medically related when you're trying to have a good time smoother for everybody involved. And it was so valuable. Um, I am going to spend a little time on the St. Louis tornado. So, in May of this year, St. Louis was absolutely devastated with a tornado. This response for us was very personal. We were there for quite a while. This was an incredibly long response, and some of the challenges we had were very political in nature, and it wasn't specifically us, it was the community that had these struggles. Sirens didn't go off in critical areas, the hardest hit area, which was also the lowest income. And it's a historically Black community. It was the 1904 World Fair homes. Um, and those homes were decimated. They weren't built for tornadoes. And so it was devastating. And we were on the ground within hours. The community rallied and just there, it was incredible. Um, and so we went in that those hours, we were able to get them water. We were able to get critical medication. It took 5 days for us to get to some of these areas because they were so impacted. There was no way to get through. The debris was so intense that you just couldn't manage it. Uh, we went into this community and there was a 7-story building that had not had power for 5 days, but it was primarily uh, elderly with serious mental illness or serious medical issues. Several were non-ambulatory. We had a lot of wheelchair users. Uh, it was devastating. We could smell the rot coming in there. The people who were trapped in their apartments on the fifth through eighth floors, wheelchair users, folks who were in their 80s. Um, we made it to the seventh floor, and there was a woman. She was about 78. She was very resilient. That's the word I'm going to use. She was incredibly resilient. She had type 1 diabetes. She hadn't had her medication. Uh, she hadn't had insulin in 4 days. Uh, she had no working electricity, obviously. And when we got up there, her numbers were I don't know how she was walking around and not in a coma, but they were about 300. And we had the ability to get insulin to her within 30 minutes with a cooler and items to keep it cold uh, for the long haul. And we had a plan in place to where we went back to that building about 3 times a day to make sure the people got their food. Because when they saw us coming in, we had our super cute behavioral health strike team vests on and we looked like government. And so they were hesitant to talk to us until we were able, so we didn't talk about mental health at all in the opening gates of that. We walked in with food, water, and asked if they had medications they needed help getting. What could we do? Um, our involvement within that community shifted and they looked forward to seeing us. We had residents who were sleeping in tents on their front lawns because they didn't want to have their belongings looted. They didn't know where to go. They couldn't get to the shelters. So we were able to do what we could and navigated at that. Now, typically after a disaster like this, you'll get like a family assistance center or something to that effect within a few days so people can get there and get help. Unfortunately, St. Louis had some struggles sorting out how that was going to happen, and it took a few weeks before they were even able to open a disaster resiliency center or a disaster assistance center. Um, and so then we manned that disaster assistance center and we tried to work with folks and get them the help that they needed. That really did help change the perspectives of some of these survivors. And it changed ours too. We were very, very affected. So we did debriefings after the fact, and occasionally we still do debriefings because they still need as much help as they can get up there. We still have people sleeping in tents on their front lawn, and it's getting very, very cold out right now. So we were able to turn that over to the city of St. Louis and to some of the mental health, community mental health centers up there. But we still work with them very closely on this. We're no longer boots on the ground there. We're operating out of our offices to assist them now. But that is one of the things that our strike team does. We don't just stop. Like if they need it, we will be there. Um, there's never, it's very hard for us to say no, but it is very specific about who can request our assistance. So let's skip over here. So really quick before I jump into this, I will say in order to request the assistance of the strike team, um, it needs to come from somebody in the city. We actually had very strangely, we had an attorney, the district attorney for Kansas City is actually the one who requested us for the aftermath of the Super Bowl parade shooting. But it went eventually made it to the mayor and it made it to us. Um, we were able to help the school. The superintendent reached out to us because they happened to know who we were. Um, with the city, the mayor was able to reach out to us. We got there very quickly, but it is restrictive on how we are asked to be there because of the funding. So that is one of those challenges. We're working on hopefully changing that. So we'll see. On this slide, let's look like our key achievements. Our key achievements are so they're very gratifying for us. We've worked with a number of city governments now who know who we are. Our governor, the governor of Missouri, knows who we are. If something happens and he gets word, he immediately asks if we'll partner and if we can get there and how we'll get there. We've developed a really, really close relationship with SEMA and the SEMA chaplains. So we have rolled the chaplaincy program into our strike team. Um, in essence, we try to cover those spiritual, emotional, and those behavioral health needs while we're out boots on the ground. It has been incredibly valuable having the chaplains partner with us. So that has made all the difference in some communities that are rural communities that are incredibly religious and very faith-based. It's been great. First responders know about us now. Fire departments will reach out to us and ask us to come. We participate in training evolutions that fire departments do or any of the EMDs do throughout the state in any county, just so they can see how we operate. That way they know it's valuable to have us there. Um, those those relationships with all of our health providers, both mental, physical, all of that has been very, very valuable. And after COVID, when we realized we only had maybe 40 people by the very end, it was very clear that recruitment needed to become a priority. So that was huge for us. Um, these were the challenges that we absolutely faced. So it was the continuous funding. Getting that funding out of the gate again was it was strategic how we had to ask for it and plan. Um, so we get funding, we have grants that allocate dollars specifically to the strike team, specifically for maintaining and sustaining new members. So we want to make sure that our training evolutions have as many strike team members there as possible so they know what to expect. And we were given some grant dollars for our next uh, conference, which will be our second conference, no big deal, where we are going to do a full scale event. We're going to stand up a disaster assistance center, or I guess we're going to call it what's it? Yeah, a disaster assistance center. Um, and we're going to emulate the resiliency centers, what that looks like, how it happens. We have a whole group coming in there and we're going to record it for training. So we're going to hopefully catch pieces and moments so that way we can use that to show A, the value, B, what to do, like what do you do in situation X as versus Y. And so that's the goal. Recruitment, that is a constant battle. We have been able to make something very great as far as our recruitment goes. So when agencies come in and want to partner with us, we love it. Where we take like private practice people if they want to come in and be a part of it. And now the agencies that we partner with have been having retention issues as well. I'm sure everybody has experienced that. We had the great resignation after COVID and still recovering from that. But people who left their agencies have reached out and said, "Can I still be a part of the team?" And we said, "Yes." So we found a way that we're able to reimburse them for their travel, get them there, and still make them a part of the team and keep it valuable for the communities. So that has been a huge step up for us. And that's only within the last year we've been able to do that. Now, the last challenge there, that awareness of our strike team in those rural areas, it is very hard sometimes to get information out to our farming communities. Um, in Missouri, this can't be isolated to Missouri, I know, but farmers, that's their livelihood. And if there's a disaster coming in, they're going to stand their ground and they're not going to leave. So when we say, hey, you're in a floodplain, can we talk about evacuating you? What can we do? That's a hard no. Uh, so then we think about aftermath. What can we do to help in the aftermath of that? But getting them to realize who we are, and then we're not just there, like they're not therapists there to try and change things. That stigma is still pretty strong in our rural communities. So that's a huge challenge for us. And we're actively working on that. Let's see here. So our lessons learned and best practices, uh, we created a content hub. And I will share that. I can't remember if I put a QR code at the end that'll take you to the content hub. If not, I'm going to share that with you because it's incredible. Uh, we created this, it's a free content hub that anybody can access. It's got educational videos. We focus on so many pieces: trauma-informed care, disasters, wellness, education-focused wellness. Um, we focus on youth. We have access to Missouri's 988 site and all of those pieces, and free for anybody. We utilized YouTube. We've recorded a lot of content, a lot of training. It's on our YouTube. Uh, it was amazing. Learfield is the marketing agency that's helped us get these things created. We do a lot of podcasts that focus on every aspect. So if you look, this little thing here where it says videos, this is the YouTube. We did a bunch of shorts. There's a lot of training videos in there. That is open to the public. Those are free. It's very nice to get those things out there. We have, this is my personal favorite. So my service dog buddy is animated now in some of our videos where we talk about service dogs and what you do in a disaster and what you need. So that's my personal favorite. Um, but we found that doing, finding ways to get these words out to the public, finding the funding to get it out there was critical. Uh, our communities have opened up so much because they're getting so much information. We have content that we've created that specifically for those with disability. So, our IDD communities, we have a guidebook for providers, a guidebook for individuals with those disabilities. They have these really handy little, uh, we call them like passports or the wallet cards that give very specific information about the individual and their disability. And they can hand that to a first responder. So if it's an individual who has autism and maybe there are some things that are a struggle for them, it gives the responder language to use that will help that individual get somewhere safely. So love that. And we have access to that on our site too. I would encourage all of you to look at that. It's so incredible. They did some really great work. We created the Teach Well initiative, which is essentially 3 minute tops wellness informational bite-sized pieces that educators, anybody in the education system can sign up for. And it goes to their phone biweekly, and it's a quick lesson. They can go to the site and they can pick out a lesson. We have things that focus on it's parent teacher night, and you have to deal with a challenging parent. Here are some tips to help with your mental wellness before this happens. That we have incredible things like that that we have worked so hard on for our communities. Now, this graphic up here, these are for DMH. These are the agencies throughout the state that have really pulled together for mass violent informational awareness. So we did that after the St. Louis shooting, and we were able to get billboards up everywhere with different pieces for help, especially regarding mass violence, which was very helpful at the time. Now let's see here. Okay. So lessons learned and best practices. Uh, we want to involve the SEMA chaplains more. If you have any chaplaincy programs in your states, I would encourage you to find a way to incorporate them into your behavioral health. It has worked wonders, especially in our rural communities. It has made all the difference. Um, we have learned that we need to expand our training curriculum. There are so many pieces that you just don't know until you know. And unfortunately, sometimes that's after the fact, and it is very brutal. And we are trying to work through that. So this this is my favorite thing here is partnerships, partnerships, partnerships. You can never have too many partnerships with all agencies involved. School systems, uh, faith-based communities, and you'll find once you have a disaster, if you need food, your faith-based community is going to come in real helpful. If you need to run shelters. Well, we have Red Cross that helps with that. But if there are other things that need to happen, warming centers, cooling centers, our faith-based communities have really come in and stepped up their game. So I couldn't stress that enough. The partnerships matter. Uh, Even if you think it's not critical, we developed some partnerships with daycares. And they came in while we were at our disaster assistance center. And so when parents would come in and they were struggling, they could leave their kids with vetted background checks. Everything was already done. Uh, Community members who ran those daycares, and they were there, and it was incredible. Those parents could take a minute to breathe. We had folks who came in who were specifically trained to work with individuals with disabilities. Um, uh, the best example of that I can give is we had a mom come in to the assistance center after the tornado. She had lost everything. She was living in a shelter. She had a 12-year-old and a 14-year-old, those two boys, and both of them had uh, extremely low functioning, some highly behavioral struggles. They were autistic, and she couldn't breathe because it was just her, and she didn't know what to do. And we happened to have one of our chaplains uh, happen to have a lot of experience working with individuals who had autism. And he and another one of our partners came in, and those two young men went to them very quickly. The bond was incredible. This mom, she couldn't stop crying because she was so relieved that she could have 5 minutes to try and figure out her next step. Um, so those partnerships matter in every way. All right. So are there any questions? I've been talking a lot. So any questions that I've missed?
We do have one in here asking you to share more about the structure of the strike team, how they're
Yeah,
activated and
absolutely.
operate in disasters, and then a little bit more of how the funding works to support the team. So any of those that you'd
Yeah,
yeah, yep.
absolutely. Okay, so the structure of the strike team essentially, so our Office of Disaster Services, we have 5 people. It's not a lot. So within our Department of Mental Health, we fall under our director's office. And then we're our own tiny little island of disaster behavioral health folks. So there's 5 of us there right now. And each of us focus on a specific disaster area. Mine is the behavioral health strike team, and we're all a part of this team. So when the need arises, we are using a system called Group Cast. So throughout our volunteers throughout the state, I will send out a message through Group Cast that says, "Hey, we need volunteers for um, these days, these times. Who's available?" And it shoots out to all of our agencies. It goes to those private individuals, and then it also shoots out to every individual um, on the team outside of just the agencies they're involved in. They can text back, they email back, respond back, whichever way we identify it out on the group cast. And then we coordinate from there. So structurally, yeah, we run it. I'm always boots on ground. I tend to do like the logistical piece. I coordinate who's going where, how they're going, how who's staying where, and what that looks like, the number of people, the specialties we need for the type of disaster. Um, and then once I have that sorted, we work out all of the those tiny logistical pieces of, well, everything you can think of really, food, shelter, all of those pieces for the responders. Um, and then I also, after the fact, I coordinate our debriefings. So once that's all done, we get that in. Uh, they we respond, and it depends on the disaster on how long our response is. But typically, we're upfront out of the gate. Hey, this is how many people we need. We're going to be doing. We're going to be participating in the FIFA World Cup this year, so I'll be there for the entire time, all 45 days. And what that will look like is I'll be coordinating on the ground which of our volunteers are going to which site, because we know there's going to be four different sites. So that'll kind of break it down like that. Now, funding wise, um, right now we have some general revenue dollars, not a lot. We have funding through the Safer Communities grant. And then we like have like HPP FAP. We have a couple of other grants that we have funding through that support different pieces, the training piece, um, and then specifically like what type of disaster. So we'll have funding that way. We do always request like the individual assistance through FEMA after a natural disaster so we can start the crisis counseling program. Doesn't always get approved, but we try. So we get funding dollars there too, depending on what that looks like. Now, does that hopefully answer that a little bit? Structurally break down, that's kind of just how we roll out. So if it doesn't, let me know. I can walk through a bit more. Yeah, funding wise, we're constantly looking for funding dollars. We're constantly asking for more money from the state. It's some of it's been a little easier going now that they've seen the value that we have. I will tell you the St. Louis tornado really made that abundantly clear, how valuable we were. And so it's been a little easier to request dollars and have more faith that it'll actually go through. So fingers crossed. We've asked for a lot more and we'll see what happens. Uh, all you can do is ask, and all they can do is say no. So we ask a lot. Now, so lessons learned and best practices. We're going to kind of continue through this. So, um, in the immediate aftermath of disaster or mass violence, the social supports can like kind of deteriorate over time. So we continue with like that post-disaster stress and try to focus on the need for survivors to rebuild. Uh, it's hard to do that sometimes. Mass trauma is a really hard piece to get information through for people. So it does take time. So let's see here. Yeah, so just different ways we've learned that you really want to get those community supports in place as quickly as possible. Um, Sorry, my little notes disappeared on me. We want to make sure that we have put in place everything. Uh, that was one of our biggest lessons learned is what can we possibly do to make sure those supports are in place long term. The St. Louis school shooting is the best example I can give of that. We did like that was a huge lesson learned. We learned we need to be on the ground and we can't just guess a time because there's a lot that's going to happen and each community kind of responds a little differently. We did learn some really incredible things. We got some trainings put in place after the Uvalde shooting. There were some really hard lessons learned that came from that we were able to utilize in our response. We were able to kind of facilitate trainings to others, to education system. There's a prepare training that was developed after that was really meant for those first responders and the educational staff who are involved, kind of what can they do, how can they do it, and we found that was one of our biggest lessons learned. Um, we have a couple of videos. I'm not going to show the videos because they kind of run long, but if you go to again, I'll attach the link to our YouTubes too. So these are on our YouTube, but they just walked through like these are just example videos um about like again the service animal one, and then this one was just kind of who we are, what we do, who we're partnering with. This was after the Kansas City shooting. So um just really great examples of getting info out to the community. So that was part of our best practices, getting that info out to the community in any way that's possible. All right. And I don't, so this picture here, that's actually me many moons ago, and that's actually my service dog, Buddy. So he is incredible. All right, let's see if I can get this to move. There we go. So looking ahead, where we're going, we want to be able to expand those teams. We do, again, a lot of grassroots recruiting. Um, I go to a lot of conferences and I talk to a lot of people and I hand out a lot of cards. And I would say out of every conference I go to now, I get about 15 to 20 people um, who send me messages back after the fact. So we've actually gone, I think in the last 8 months, we've added almost 100 people to our team. And right now, I think we're almost at like 312-ish. So it's been incredible. Um, so the conference that we put on, we've learned that is incredibly valuable. We get people from every community to come in. It's great. Educating our emergency managers. I do a lot of that. I travel throughout the state and I go to every emergency manager meeting and I talk to them about who we are, what we do, and I offer to come and be a part of like their CERT teams, to stand to like just to show them who we are and what we do. Um, the victim advocacy and public safety, we've recently developed a partnership with our Department of Public Safety. And so they're hopefully going to be looking at after a disaster, what can the behavioral health strike team do to assist them? So we're not trying to step in and do any of their crisis intervention things for the traditional mental health and law enforcement like dynamics. We are specifically, obviously, disaster focused, and they have found that that's necessary, especially after tornadoes. Um, we do a lot of full scale exercises. Like I said, we need more. We're trying to find ways to get more out there and get more people involved in those trainings. The pickle that we found is that the agencies don't necessarily want to send them to the trainings because it's expensive. Oh, good question. I can answer that. So the questions, can I discuss how I maintain my deployment ready roster list, checking licensure, certs, and the method to maintain it, who does it? So that's a really, really good question. So what we do, we have a running list. We use Basecamp, where we have access to all of our members. Then we have our intra-office like SharePoint where we have a running roster. We have an admin person who goes in and tracks all of that. So we have that running active roster. I use Groupcast where I send out all the notifications, and we'll randomly send out test notifications that say, "Hey, um, are you still interested in being part of the strike team? Please respond back. If we don't get an answer, we're going to assume you're no longer interested." uh, People tend to respond, but we'll do that via email, phone, and text. So, um, as far as licensure, certs, and expiration dates, we have again just this working list that we run off of. Essentially, it's just a spreadsheet that we have tracked out, and we'll get notifications that say, "Hey, uh, this person's cert is about to expire. Please get a new certificate." We were using the Show Me Response system that was a part of like the state emergency management agency, and we started to drift apart from that into our own tracking system because it was very challenging to maintain all of that. So, and then the folks that do maintain it, so I check it monthly, and then I set reminders of who needs to be contacted, how they need to be contacted. Right now, we're still small enough where it's not too hard to do, and we partner with enough agencies where they do a lot of their own tracking, and they'll let us know, hey, this person's no longer with the agency. Can you remove them from your list? It's all about those partnerships and kind of keeping that rapport up with them. But we do keep our own running list, so we're not stepping over. But the great thing with the strike team, uh, we don't require anybody to be a licensed therapist. They don't have to be any of those things. They have to have psychological first aid. And with psych first aid, you're not diagnosing anything. You're simply ears. You're simply there to listen. Um, listen, validate, and do whatever we can to help them ease off in that moment. The only thing that we have clinicians a part of that where they're actually in that clinical status is when we do a victim information center event. And that list of people is much, much smaller than our strike team listing. So I track that and then we'll take them with us to any Vic events that happen. So with the Vic events, that is again, I don't know if many of you know what like a victim information center is, but after a mass casualty event, it's essentially where those family members go to um, identify their lost or missing loved one. And then we partner with like the mobile mortuary, highway patrol, and we'll do everything from the minute they come in the door until the minute they leave. They have what one of our care team with them, which is a clinician and a chaplain. So that's kind of a specialty. We do have specialties within our strike team. That's one. We do repatriation as well, but those take a little bit more to get into. So, um, really, that is, let me jump through. So, that's kind of who we are. That's what we do. Um, if you guys have any other specific questions, that's, I'm going to leave that. Hold on. My email is up here. If you scan that QR, it does take you to our website. And then we're also on all of the socials and all of the fun stuff. So I'm Tamara Fish, like I said. Mine's the dmh.mo.gov up there. Don't hesitate to email me. I'm happy to send this presentation out to you if you want to use it as just informational. I'm happy to walk people through what we do, how we did it, and more depth. So I don't want to take too much time, but does anybody have any other questions? Okay.
There, there was one question in here, but I think you covered it. But if we didn't, he was just asking if the strike teams were part of DMH, and I think okay, no,
Yeah,
you're good.
so we have DMH members who are on the strike team, but they have
No,
to go through their supervisors to get approved, but it's in like an outside. One of the things that we do is those MOUs with the agencies. That's a really good question, actually. So we reimburse them for the time that person is with us. So essentially, they would just be doing their normal job, but they would be with us, and we cover the cost of their time, the food, the transport, uh, and lodging. So if they're with us, and we reimburse the agencies. And for
okay,
private individuals, we reimburse privately. For DMH, they get no they're a part of the team. They're DMH, so that's their job. So,
right, right, right.
but yeah,
And I had two questions.
yeah,
Well,
absolutely.
the first one was you've mentioned this conference a number of times, and
Oh,
so I was going to ask for anybody who may be interested, like, is that something that's open for anyone to attend?
100%. Yeah,
And if
please
so,
attend.
so if
I
you
will
have any,
put, yeah, let me see if I can find that really quick.
perfect.
But yeah, we are very excited about it, and I'll pop the registration up here. Sorry. It exists somewhere in my emails. The registration just went live 2 days ago.
Okay,
So, I mean, it's very exciting.
good deal. And then the other question that I had is, I mean, you spoke primarily about um, this team being there to serve the citizens. Have you guys ever gotten pulled to serve your responders in this same capacity? Like as you
Mm,
get pulled. to those various events? You know, you've
So we haven't, they haven't necessarily asked us, but we automatically do it.
mhm.
So when we're working that closely with them, we always try to schedule debriefings with those responders after the fact. We offer it up and then we do check-ins with them constantly. So we have, there have been, I think, like I said, the very first deployment we went on, we were that they absolutely needed it. And so they did ask for the debriefings. And then after the Joplin, well, we weren't there yet, sorry. The St. Louis tornado, we did a lot with um, the responders outside of that because it was very traumatic for them. It was traumatic for everybody actually, because nobody anticipated it hitting, the most urban part, like it was such an urban city. So it was crazy.
Gotcha.
All right, let me see if
Um, then there's also a question of sharing the link for the content hub. Is that different than the disaster services site that?
it is. I
Okay,
have a link for that. So I was trying to find my little thing here. Let me see if I can find it. If not, can I email? If I can't find it, can I email it to you and then have you send it out? Or
sure.
is it easier to do it here?
I can absolutely send stuff out to folks who are on the call and everything, or on the
Perfect.
webinar today.
So right here, I don't know if it'll let me. Okay, yeah, I have a. Let me stop sharing this real quick, and then I'm gonna see if I can't share this. All right, so this is the flyer basically that I send out to folks. Um, it's thinking about it, but that is actually the QR code to our content hub. And you should be able to find the link to our conference in our on our website too.
Perfect.
But I'll send that out just in case as well.
Sure. And I'm happy to we can send out a quick email with folks afterwards just so that they know where it's going and or
Yeah, and
when it's
like I
coming and
said,
stuff like that.
it's $50 to attend it, and it's not like crazy. I mean, the travel, the hotel, all that, that's unfortunate, but $50 to go to a nice conference, and it's top shelf stuff.
Good deal.
So yeah, that's let me know if there are other questions. You have my email, and I will send these things out to you, and you can share with everybody.
Perfect. Um, well, I will say we are at the top of the hour, so I want to respect folks' time if they gotta jump to go do whatever. I'm not seeing any other questions in there. I did see someone
Perfect.
just put in the looks like the conference registration.
Oh, nice.
Um, so that's
Great.
been shared out, but we'll make sure it gets out to everyone else as well. I want to thank you for coming and speaking about this today. Just a ton of information, and I'm excited to see where your team goes and everything. Obviously, there's a need there, and people are starting to really buy into and get into that need, and so it's exciting to see where you guys are going to go from there. But appreciate you coming.
Thanks, everybody.
And if anybody needs to get a hold of either Tamara or myself, feel free to reach out and we can get you set up. Otherwise,
Perfect.
I will let everybody else go and have a great afternoon.